in there. Okay. So what are the objectives? Explain the importance of medical terminology. Understand medical terminology. We need to understand them. And when we understand them, it's essential for accurate communication. Okay? You are able to communicate to your colleagues what they need to do. Reduces error in medical settings. So if you are able to communicate the terminology to them, which is related to the procedure, it reduces or it eliminates what mistakes. That's what it means. Enhance job performance. Once you know the terms, you know what you're looking for, you know what instrument they need, it makes the work easier performance, improve efficiency in tasks, facilitates better understanding of procedure, ensures patient safety, prevent misunderstanding, promote proper handling of medical instrument, professional development, increases your knowledge base, and opens opportunity for career advancement. If you know the terminologies and you're able to apply them, you qualify to be a lead tech for your shift. You qualify to be a supervisor for your department, your shift. So when we are looking for people for leadership, we are looking for people who have a lot of knowledge. They become resource for the rest of their colleagues. Okay, you cannot go and take somebody who doesn't know to lead the department. You're all going to fall inside teach, right? Identify various elements in medical terminology. So prefix is before. Pre is before. Okay. Pre is before. Okay. Yeah, like premature. Yeah, pre is before. Like the way somebody is. Some people, Mr. So. The Mr. is the prefix. Okay. And then so junior or so the te is the suffix. Okay. The one that comes after all the titles. All right. So prefix in medical terminology, common prefix and meaning is this word comes before the main word, and we tell you which part of the body or what is going to happen. That's the prefix before the main word. Examples of medical terminology with prefix. So we're going to look at that. Root in medical terminology is the root is the main word. That's the main. It tells you what is going to be doing. Is it going to be this part, the hand part, the leg part, the ear part? Okay, so that tells you that. And what I'm going to be looking for about the definition and importance of the roots and examples of. We also look at examples of medical terms with roots, and then the suffix is after. All right, and like I gave you the example of so chief the third, so chief the third, so junior, so senior. Those are the suffixes. Yeah. So, but in medical terminology, it's different. It tells you what happens with after the root word. That's what the common suffixes and their meanings and examples of medical terms with what suffixes. Root words. Root word element is primarily is the meaning of the medical term. The root is the meaning of the medical term. By definition, the word element. Now, modification of medical terminologies can be modified by, so they are modified by either the pre or the suffix, the prefix or the suffix. The root can be modified by the prefix or it can be modified by the suffix. If it's modified by the prefix, the meaning is different. If it's modified by the suffix, the meaning is also different. But as for the roots, the main idea remains what? The same. Are we there? Good. So let's see. Suffix words element comes after the root words. See, it comes after. The prefix comes before. Okay? Then added to the root at the end of the word. It is added at the end of the word. And then can alter or modify the meaning of the word, the root. So it can change. Once it's added after the word, the root, it can change the meaning. And if it's added before the word, it can also change, which is the suffix. We'll look at that along the line. Common medical and surgical suffixes. So, importance of suffixes in medical terminology help to identify if the term relates to a surgical procedure, medical condition, or anatomy. Common medical and physical surgical suffixes listed in figure 2.4 and 2.5. Tell me your book. Give me a couple. I don't have it. Figure 2.4 and 2.5. We are looking at our suffixes. Let me see if I can. Okay, let me get one book from the director's office. See Page what?
Page 17.
Please, I'm in trouble. I don't need my glasses. Okay. So one of it is plastic. Plastic. So you see the suffix, you have the prefix column, the roots, and then the suffix. Okay. On is it page 17 or page 60? You have page 16 and 17. Yeah, both 16 and 17 is where you can find those. This is our focus is what the suffix for now, since it comes after the word. So the root word. So plastic. Rhino. What's rhino? Which part of your body is rhino? Can somebody take a guess? Rhino. Your nose is rhino. Okay. So if they say rhino, it means nose. So if you say rhinoplasty, what does this mean? They are doing plastic surgery of the nose. You see the whole thing. So rhino is the main word, the root word. In this case, root word is the rhino, but the plastic is the suffix, and it modifies the root. Nose, plastic surgery of the nose. You get what we're talking about? Right. That's how those terminologies are used. So once you see on the schedule, you see the schedule that they bring. You see that they rhinoplasty. It means that anything related, any trade that is in the department that has to do with nose, you have to prep it, get it ready, because the doctor can call for it. You see what? Yeah, so let's continue. Characteristics of suffixes. Oh my God, don't break. Good. Word elements that come after the root word. So we see that. So maybe one or two syllables. So plastic, it means plastic is repaired. So, okay, plastic means they are repairing or something. Anytime you hear in the hospital say something plastic, it means that something is damaged and you have to repair it. Okay. Tympanoplasty means your ear. There's something wrong that you have to repair. Okay. So go sit down, look at that chart there. It's not difficult. I promise you. But you get the question right. question from either page, 6 minutes to get a question. This topic, you get at least 2 questions from this. All right? So go there, go sit down and look at that carefully. All right? Let's go. Common medical and then surgical roots. The root is the main word. We said that. We saw that already. It refers to the main body of a medical word. Importance of roots is the foundation of medical technology. So, rhino, this. Okay. What other terminology can I get? Let me see if I can find one here. I probably have to put my light on. Can't see. Forgive me, guys.
Cardio.
Cardio. Cardio heart. See, cardio heart. What else? Okay, so let me see. Thyroid. Yeah, the neck. Throat. Sorry, yeah, throat. You see what? Cyst. Cyst is your reproductive organs section. Okay. Yes. Heart definitely is your. The thoracic is your what? Your chest. Thorax. Yeah. Your whisk. So those are the key or the main elements of the word, or right. Examples of them are cardi, which is heart. I didn't even see that. Gastro, which is your stomach. Neuro is your nerve. Okay. Yeah. Right. Let's continue. Quick. Challenges with incorrect instrumentation. One is issues with incorrect instrumentation and supplies. What is the impact on surgical procedure? If you put in wrong instruments, what is the impact on surgery? It says OR receives case cards with incorrect items. Diverse attention from schedule. To see the delay, and one is increases of the patient's life. So you see how important your role is. I'm telling you guys, your role is very, very key. In some hospitals, I remember when I started this work, at the end of the year, we used to get envelopes with gifts from the doctors. Maybe $100, say thank you for what you do. Okay, it's better than nothing, right? Some big feels that $100 is peanut, right?
So it said, it will go for like.
So you expect me to say 1,200 or 1,000? Maybe it's 2010. Sometimes these days they don't give us the money, but what they do is that they buy food. They give a party or they organize end of year party. Like last year, there was an anesthesia. The anesthesiologists, anesthesia doctors was organized end of year party. I'm not alcohol type, so I've never been to any party. I've been working for about 14 years. I've never been to party because people go and drink and then they're doing all kind of crazy stuff, and I don't go. I've never been there. So let's go, guys. Evolution of surgical procedures. Traditionally, surgery was done with the OPU valve, right? And then when they done the surgery is done, they close There's a line. It leaves me with some stitches and what have you. Today, it's not like that. 100 years ago, that was what it was. But today, what are we getting? We are getting minimally invasive procedure. You just open some small space. Enter there with complex or sophisticated instrumentation. Do the repair, do the treatment, do everything, get out. And then you close the place, you never know that surgery has happened. And what do these minimally invasive procedures come with? It comes with complex instrumentation. That is why we need good brains like you to handle that, to process that. It's not like the Stone Age time. All right? Let's go. Minimally invasive approach. So if you go to if you are hired and you hear today, tomorrow we have 5 MIS. If you hear tomorrow we have 5 MIS cases, it means tomorrow we have 5 minimally invasive cases. That's what it means. So you need here MIS the same as minimally invasive surgery. Okay, MIS, minimally invasive surgery. So those ones, the opening is small. They use small instrument and very complicated or complex instrument. Because the opening is small, you use less, you spend less days in the hospital for what? Healing. The recovery is what? Quick. Unlike big opening. Okay. So let's look at this situation. Let's say there's a lump in your stomach or in one of your lungs or intestine. They open a small place, go in there, take that lump out. Compared to opening your thoracic and doing maybe heart transplant, which of them do you think will get out of the hospital quick? And that's what we are talking about here. Okay, then we have orthopedic procedures. Orthopedic has to do with your knees, your hip, your ankles, the bones. Thank you, Ajia. Thank you for helping me make my work so easy. When it comes with bones, that's orthopedics. Anything bones is orthopedic. But the MIS can be what? Bones too. They just use pins to plant some pins in there, leave a pin in your body, you go about doing everything. When the place heal and you don't feel what you used to feel for which you came there, you go back, you open and take the pin out. If you work in a hospital, right, human beings not. Tell you go and see somebody lying on the bed, you're working on him, just playing with his intestines and everything in there. At the end of the day, they close his eye and then you get up. God is good. Yeah. And medicine is very interesting. I wish I could go back to school. I would go to do medicine. But I'm too old for give a class. Let's continue. All right, close reduction and percutaneous peeling. Close reduction is an attempt to align a broken bone without doing surgery. Have you ever experienced that growing up, especially with the guys, you go and play soccer or football, and then sometimes you get hurt, you see that your part of your body is swollen. You don't go to the DC, sometimes you take it to some. Most of us come from and take it to some elderly person, and then you press, and fix it, and you can't listen. That's close reduction. That old man was in, but I didn't know that he was in that. That's what it means. Okay? All right. And then
they have the idea, but they don't have the
yes. Because we had my village, we had some elderly man, he passed away. That was his job. You go, he would, if the place is falling, he will, or the is healed even, but it's crooked. You go, they take you there, you just be talking to you as if this, and then you use something to hit the place. You break it again, then you start treating you gradually, and then so I don't know how he was doing that, but it was perfect. So that's close reduction. Then percutaneous were pinning. That is accessing the bone, broken bone through the skin, okay, and then using the what stamen pin. Stamen pin is just any pin, but it's pointed, so they plant it in there. That's what I was telling you, that they plant it in there, hold the place. You go live your life normal. Have you seen somebody sometimes wearing some orthopedic boots? Yeah, so they have nails in there. The pin is still there, holding the place. They go about doing their activities. After some time, maybe 3-4 months, they come back, they open, take the pin out, close the place.
I have a brother who has done a surgery and the metal has remained in this.
Yeah, some people, the metal stays there for the rest of their life.
Yes.
Yeah, so that's what. So when you somebody like that, when you're traveling, you have to let them go so that when they scan you, they don't say you are carrying some bomb. All right. Yeah. And then we have close reduction internal fixation. Sorry, open reduction internal fixation. That one they open, they cut open, the bone is broken, they cut open. The serious broken one, they cut open, and then they use screws and plates to hold the bones back. They leave it there, close it, you go and live your life. After a couple of months, then you come back, they open the place again and screw all the screws, take out the plates, close it back. Now, science is good. Yes. It's just like, so the human body is just like a car walking, like being driven in the streets. Because the car breaks down, you take it to a mechanic. Our mechanic is the doctor. Very interesting. So use of plates and screws internally. And
I have a quick question, sir.
Okay, go ahead.
I heard the use of the plates and screws internally, like you said. We have some people, they said it takes maybe a year to take it, and some people don't want to take it out. Is there any problem after the use of the plates with the broken bone, like on the left or the right arm, and they fix in the plate? Is there any problem if you don't want to take it out, maybe after the bones are cool and you want to leave it in, like internal or something like that?
I'm not a doctor, but I want to believe that the doctor will offer you the pros and cons of leaving it, the benefits you get if you leave it there, what are the effects that you get if you leave it there. So the patient has the final say. It's a decision you will have to make. If you want them to take it out, the doctor will take it out. If you don't want them to take it out, they will leave it there. Okay, so it is sure. But if the doctor recommends that you'll be better or your health will be better if you leave it there, then the option to go for is to leave it there. But if the doctor says that as time goes on, you will heal better, maybe 5 years time you heal better, completely healed, and you don't need the piece in there, in 5 years, come back and then they take it. But you see, some people have the trauma of coming back for them to do anesthesia, for them to go to sleep, for them to cut open them and then take the thing. They don't want to go through that again. Say, okay, since I'm okay, I'm not having any problem. You just leave the thing for me and I will go. Be fine.
Gotcha. Thank you.
You're welcome. All right, so let's go, guys. Laparoscopic versus open cholecystectomy. Yeah. Cholecystectomy. Yep. All right. So laparoscopic is we're talking about the use. I don't know how to describe it. I wish I had it. No, I don't. Now, so it's minimally invasive kind of thing. So they make some openings and then they go in there and do the surgery laparoscopically. You remove the gall, if they go in and check your gallbladder and whatever. All right. So that goes into your system. All right. So procedure often booked as laparoscopic, less traumatic to the patient's body. They just open some small, they just use a knife handle, knife blade, puncture a hole, okay, and then they use the instrument to go in there, connected to the monitor, then they see it. And then they do there and play with your intestines and get out. All right. The conversion to open cholecystectomy if laparoscopic approach fails. So if the laparoscopic fails, then they now do the open. All right. If they cannot see it, it's not wide, it's a bit complicated, then they do the open. Then we have thoracic what? Surgery. Thoracic. That is chest. Open your chest, and then you take care of your open. Often start with what? Thoracoscopic what? Surgery. Use of what? Endoscope instrument to access what? Lungs. So when they're doing, because these they don't want to open people. Before thoracic is just they have to open. Okay. Now they can just make an incision, a small opening, enter there with endoscopic what? Instrument, which is normally sometimes a flexible or rigid, flexible scope or rigid. Sometimes if it is flexible scope, they can pass it through your mouth and pass it through the esophagus and all of those things, and then enter and see what's going on in there. If it is a rigid one, it's an office small incision they will do maybe on your side, and then go there and examine, take biopsy, do whatever prognosis they need to do, and then they get out. Okay, yeah. And conversion to open. So let's watch this. That I've just got some. Watch this. Let me see this word. O-M-Y. You see that one? Okay. You come here. O-M-Y or T-O-M-Y. Okay, Tommy. So you see, what I say? The first one says conversion to OP. This also say conversion to what? OP. So Tommy is cut OP. You get it? So it means cut open. So the thoracic tummy, thoracotomy means that cut open your chest. All right? Yeah. So the tummy becomes, in this case, becomes the suffix.
A quick question, boss.
Yes.
So if I got the clue of what you're trying to say, everywhere we found a word with the end of tummy is going to be a open surgery. Is going to be, it's either going to be open, not internal. It's going to be yeah. Okay.
Excuse me, sir.
Go ahead.
Can you please mention the words again?
Which one?
The convention to open CHOLEC whatever Tommy, and then the other Tommy down there. Yeah, I want you to mention it again.
Who is that? Is that Fatih?
Yes, that's Fatih.
Oh, Fatih, you didn't give me $12,000. So you want me to make
I want you to mention again, please.
So the first four words, the first four letters is what? Co. I want to break it so that it will be easier for you to mention it. Okay. So the first four letters is what? Co. The next three letters or four letters is cyst. Then the remaining is ectomy. So cholecystectomy. Fatih, do that make sense?
Very well.
You are in the phone and you have been saying it over and over again. You will have to slow down in saying it if you are seeing it for the very first time. Right. So it's Cholecystectomy. Cystectomy. Cholecystectomy. Don't go and bite your tongue, Patty. All right, and then the other one is thoracotomy. Thoracotomy. Yeah, thoracotomy. I can't even say it. You Patty, you just want to put me into trouble now. All right, so go and learn how to say them. And then thoracoscopy is if they are using the minimally invasive, you always end with the PIC. There's a small opening, go in. If that one fails, then they cut. That's why the tummy comes in, right? Okay, let's go. Less invasive approaches in breast and prostate surgery. So breast surgery, either you want to impress your husband or your boyfriend, then you go for breast augmentation. That one, because call it cosmetic surgery. You want to make your stuff big or heavy. All right, that's different. But if say you have, God forbid, again, you have cancer and those kind of things, then they need to take out something to be able for you to live. That's different. Okay. So start with minimally invasive biopsy, followed by lumpectomy. Means they're going to cut open and take out something, right? If needed. Partially mastectomy. So it means that they're going to cut the whole breast. It's very simple. If you get the meaning or the understanding from the word from the beginning, it's easy to just be linking it and then we go. Right. Okay. That mastectomy for removing a portion of the breast. Okay. The radical mastectomy for complete removal. It means that excuse me to say, if they do that, you probably have to wear artificial breast. Okay. Prostate surgery. Transrectal resection of the prostate. So whenever you see this one, in my hospital we do it a lot. The tap we do it a lot in my hospital. We do it on Tuesdays, we do it on Thursdays, and sometimes Fridays, depending on the surgeons. Right. To reduce trauma, and then endoscopic techniques preferred if possible. Yeah, you were going to ask.
In the lymph, in the breast, if you have a lymph in your breast, I think they cut and take the lymph out.
Yes, they first they could make an incision, go there and see is it something that big. If it is at the early stages, it's small. They can just go in, they make an incision, go in, they take it out and rub it. But if it has grown big and spread, then probably they have to go in there and scoop. So that means that they have to cut so that they can have access to the place to scoop. But if it is so massive, it's life-threatening, then they just have to chop off your breast. Unfortunately, right? Open procedures for certain conditions. So you see, these pictures tells you about orthopedics. You can see the bones, somebody's foot. Not all patients are suitable for MIS, minimally invasive. So some illness and injuries require open procedures. That's what it means. Cancer requiring what? Resection. So significant growth inside an organ or body area. Okay, they have to open. Breast cancer. All right, prostate, severely broken femur. If your bones are broken so heavy, they have to go open and then have access to the place to fix it. Impending gallbladder rupture. You have a ruptured gallbladder, they have to open the place to have access to do the surgery, to do the repair. Importance of our understanding surgery schedules. We saw that. It gives us ample time to prepare to get the right instrument ready for the surgery if we get the right schedules. So causes less trauma to the patient body. Importance of minimal units. We have seen that reading schedules, laparoscopic often precedes laparotomy. Okay. So laparoscopic means that you go in with a small plate opening, but if you cannot, it's not helping, you cut open big. Arthroscopy, small. If it's not working, you go to arthrotomy, cut open, more. Fluoroscopy, small opening in the chest, is not happening the way you want it, bigger cut. All right. Instrument and supply requirement. Different instrument for minimally invasive versus open procedure. So if it is small opening, the instruments are different if it is what? Big. Okay. I'm going to see that we don't have both landers here. Yeah, now. So they have something you open, they retract the instrument. They use the retractor to hold the open place in place so that they can have access to
something like scissors, right?
It's not scissors.
No, the metal is like two.
Yeah, two. It has a screw that you open and lock it in place, and then you hold the body, the cut open body in place, and then they work with it. All right. They can have access, and then they have some headlights they wear, and they put it over, and they see everything, every detail. And beside the headlight, they wear glasses too. Powerful, wear glasses with powerful lens so that they can see everything. To do that, okay. Yeah. So that's that. Let's go. Nice. Advances in surgical techniques. Importance of endoscopic procedures. Yeah. Reduces our patient trauma. It's not dangerous. It's not like in Ghana, some of us who are coming from Ghana, if you hear that they're going to do surgery on you, it's like you are not going to make it to, oh my God, they're going to kill you. The surgery here is people feel like people love going under the knife. Yeah, because it's so advanced that you feel that you'll be safe. I have never, maybe one or twice that I've had that patient came to do surgery and didn't make it. Most of the time, those patients are very, very old people. That's why. But if you are healthy.
Question, please.
Yes.
Okay, I'm taking you back. Okay, if I may understand, all the words that end with tummy, you said it means open surgery, right?
Yeah. Cut open.
Okay. Cut open surgery or open surgery. I'm confused there.
Why are you confused? Don't be confused. Anything that says tummy means that they are cutting it open.
Oh, okay.
Yeah, you get it?
Okay,
Right.
yeah. Thank you.
If anything that says copy, that they are making a small hole and going there to do.
Using endoscope.
Using some sophisticated instrumentation. All right. So new advances in surgical techniques, less invasive than traditional MIS. Then robotic technology in surgery. Robotics, the machine is doing the surgery. They just control it. You see the way sometimes our children play the game. They press the button and that's how they do it. So they load the arms and then they're just sitting there pressing and then watching the DC. They are playing with video game with your body. All right. So Fatih's where cholecystectomy, gallbladder removal, and then hysterectomy, uterus removal, and then prostatectomy, prostate removal. So the root words are the toe, the hyst, and the prostate. Then the suffixes are the tummy, come after. And because of that, it changes the meaning of the root word. Robotic technology in surgery, where robotics, you see that the goal is a giant machine that they use to do the surgery. All right, they load the arms on it, and then they control the buttons to do the surgery. So robotic technology in open heart procedures utilizes highly specialized instrumentation and supplies. Least invasive form of what? Surgery. And then most technologically advanced surgery in history. That is the most that I can think of today. Robotic surgery is taking place. It's probably going to kick out a lot of doctors. Now they say a time will come, you just go, and then once you just set up the machine, then the doctor can go and sleep. And then when the surgery is done, maybe to ring a bell, ping, and then you come and disconnect everything and say, go home. That's how science is evolving, or medicine is evolving. The role of CS is responsible for reprocessing these complex devices. Yeah, robotic. You do that. Procedure approach, and then purpose. Okay, let's see what's under it. Identify procedure purpose by what? Suffix. So we want to see, when we see the end of the roots, or the word that comes at the end of the roots, what does it tell us? What is it for? What does it? Is it OP, minimally invasive, or what? Or is it removal or taking partial? So suffixes indicate procedure purpose. Oscopy. Oscopy means visual examination and possible treatment. So you go there, make a hole, go with the scope, and go and what? Examine. And if you find any abnormality, you take care of it, or you treat it. Then otomy, making incision. Otomy, making incision. Then ectomy makes removal. Usually that cut open removal. And then plastic means repair. Plastic, that's why we say rhinoplasty, tympanoplasty. Okay. Which other terminology that I can think of about plastic? Nothing's coming. Everything is vanished from my head. Let me see if I can find any other plastic. Okay, I don't see any. All right. So maybe as we go down, we'll see. So oscopy, otomy, ectomy, plastic. So those are these words that are in. Is it asterisk? Those are the suffixes. They come after the main word. Maybe in the subsequent pages we see the prefixes. Then laparoscopic cholecystectomy, removal of gallbladder. Okay, ectomy, removal. Otomy, creating a bigger hole into it. Okay, robotic assisted prostatectomy means that robotic cutting or removal of prostates using robotic means. That is removes prostate using robotic instrumentation. Bilateral maryngotomy. Marigotomy, sorry, marigotomy, bilateral, marigotomy. That has to do with what?
They cut both.
Yeah, bilateral means that both sides, the left and the right ears. Okay. Marigotomy has to do with your hearing something, your ear stuff. Okay, so they go in there and then whether to clean or to take something out. Sometimes your ear gets so choked with how do you call it? That's brown stuff. Huh? Wax. Thank you. Today my English is not coming. The wax. So you go there, they take out the wax, so that sometimes when you choke with the wax, you can't even hear something. You hear some strange sounds in there, and then you have to do like this. So you go there. They say we should use. Sometimes they say we shouldn't use the airbags. We have to clean it, right? Because if you go to the ear doctor, for that 2 minutes that they will go in and check, you pay good money. All right. So I'll just get my Q-tip and then go there and make do my thing. Right. So then we have anterior cervical fusion. That is bilateral marigotomy is an incision for drainage in both eardrums. Okay, so bilateral, anytime you hear bilateral, it's both, but two things. Two. Okay. So if it is you're being working on 2 fingers, you hear ba. But they say the fingers is either on the right hand or the left hand. So you say left bilateral something. That means left hand by 2 fingers.
You do the ladies bilateral episiotomy.
Okay. See, that's right. We have a lot of resource persons here. Okay, so let's use them. Thank you for that. The anterior cervical fusion. It says fuses cervical vibrate from the front. Okay. I hope our ladies understand what that means. Okay. Kajiko. See. Next time, I'll before I come to class, I'll see Fatima before we go. Posterior lumbar antibody fusion that fuses lumbar vertebrae from the back. Okay, and then vaginal hysterectomy. Okay, vaginal hysterectomy. So it has to do with the reproductive part of the uterus. Okay, of the female. And then total abdominal hysterectomy. Sometimes they will not say the whole word. They just say abdominal hyst or vaginal hyst. It's the same thing.
But hearing the people, you know if the uterus that they are going to happen.
Yeah, no, but because you are familiar with it. Yes. That's why. Yes. Not everybody knows that. Okay. But at least certain parts of the body or words will tell you. If you hear the word vagina, you know where they are going to go. Right. Okay. Abdominal, you know. All right. So those are the giveaways. But hysterectomy, sometimes if you meet this word the first time, you might not even be able to say it. All right. So yes, we need to learn it. Good. Prioritizing what? Schedules. Importance of instrumentation is ensures devices meet patient needs, allows for safe and effective procedure, scheduling and delivery. Devices delivered well in advance. That's why I told you that the cases, the instruments are picked the evening of the day before the surgery. So tomorrow, Monday, we'll pick cases for Tuesday.
What about emergency case?
Emergency case is emergency. The word is emergency. So you come, you pick. Let's say, no. We don't have this. Let's say somebody, I work on in 14th Street, right, in Manhattan. Then we are there, and then somebody collapses, and then they bring him to the hospital. It's not scheduled. We just have to say we need this. They will grab it from the store. We give it to them, and then they say the person. That's emergency. I get it. Yeah, it's not scheduled. We have emergency. Scheduled cases are the one that the person went for testing. They went for all those conditions, and then they say, come so and so day for procedure. Okay, but emergency, you fail, maybe you get bleeding, they need to stitch the place. There's nothing like wait to go and do this and come. No. They go in there, they do everything, and they get out. So examples of scheduling, this is example case, thoracoscopy, possibly they can open or make a bigger incision. Pick list may vary depending on what the doctor is looking for. That's what I mean by pick list. You remember I mentioned pick list or preference card, the same thing. Additional information, loaner instrumentation discussed in chapter 11, which is chapter 11. Loaners, we'll talk about loaners. Loaners are, you don't have, you go and borrow. That's what, loan, right? Think about the money you go to the bank to borrow when you are in need of a loan. Same thing. It's an instrument you don't have, you go and borrow, you use and send it back. But you have to pay a fee for using it. We'll get to that when we. Importance of medical terminologies. It makes the work easy if you understand the terminology. The way Fatima understands it now, if she see the surgery, she knows what to do. If she can help her friends to do it. Okay, understand medical terminology is crucial. It ensures clear communication with the OR, and then it makes it easier for you to prepare what you need. Components of medical terminology, we talk about this. Prefix, the roots, and then the suffix. They are the keywords, not just for memorization, but practical use. All right? Try to use it as much as possible. But I don't know, maybe if you are a genius like. All right? When you know it, what are the benefits? Improves departmental efficiency. When you know the terminologies, you see the schedule, you say they are going to do vaginal hits. You know what trays and what trays can do that. You need some spectrums to be able to open the vagina to go in and do it. That's how. So any tray that has spectrum and some curettes in there, this is, you know what to do. Some dilators in there, you know what to do. Right. Enhances communication and service quality, contributes to positive patient outcomes. So when you know the technologies, you are able to give the right instrumentation, and then the result is going to be great for both the patient and the department. Responsibilities as a service tech. Timely response to operating room staff, and that involves essential for effective operations, ensures smooth surgical procedure. Your responsibility, assisting surgical and medical staff by delivering high quality care, supporting patient treatment. When you support the surgical team, you will help by delivering quality care. The patient comes in, it goes out. The patient comes in, it goes through registration. If it's at registration, the board will show that the patient is in the hospital. If the instruments are not ready, they have to go and tell the patient, hey, we don't have the instruments. We have to wait a little bit longer. How do you think the mood of the patient will be? Will he be happy? No. But if we are able to do this to support the team in the OR, patient will be happy at the end of the day, right? So, and how can we get that done? Effective communication. If we know that the trays that we need is not going to be ready by the time the patient is scheduled to come in, we can tell the patient maybe 2-3 hours ahead of time. So that say, don't come in early. Wait when we call, then come in, or we change the time that the person is supposed to come in. Continuous learning. We said that we always have to have new things are coming, so we also have to be updating our system. We are going to be updating like the way if you have this iPhone, you always get one iPhone something something. That number, then you go. What one? iOS, right? Yes. Then you go in there and update so that you get the new version of the phone. That's how our work is like. You always have to go in there and learn something quick so that you can function well. Stay updated with medical technologies. Let me see. It's not moving anymore. Salim, I'm in trouble. Okay. Let me see. Yeah, I'm doing that one. It's correct. Yeah. Yeah. Oh. Sorry. Okay. I don't know whether there's no slide after that. If there's no slide, we should have gone to conclusion.
Yeah, what? Let me see. Yeah, we didn't give a conclusion. So summarize. I think that's it.
Okay, all right. So that's great. We are on time.
Yeah.
Yeah. So so basically in medical the technologies, right? We have the suffix and then the main word, which is the root, and then we have the suffix. The suffix actually tells you what is going there. Is it a repair? Is it examination? Is it a removal? Is it a cut open? That is the suffix. But let me see if I can get some prefix for your table there and use it to set an example. Okay. So yeah, Hemi. Hemi is a prefix. Hemi means half. So bilateral is a what? Bi is a prefix. 2. Okay. You see the water?
Yes.
Fatima?
Yes.
Yeah. And let me see if I can get another one that will. Then another prefix is para, P-A-R-A. That is beside or near. So if you see para something, it is beside. Okay, or near. Let's say I'm not very familiar with. I don't see. Let me see if we use it. Use it in a way. Okay, so yes, pareidotomy. Yeah, thyroid. Okay, so by the thyroid, that's what it means. By the thyroid, that's what it means. Okay. Para, P-A-R-A. Yeah. Pareidotomy. Yeah.
Okay. So the para will be
the prefix. Yeah. Okay. Hemi something. Hemi is the prefix. The word that comes before the main word, the root word. And then the one that comes after the root word is the suffix. And in that one, it tells whether it's you are doing a repair, you are doing a removal, you are doing a cut copy, or you're just going in there to examine and get out. So all that we have done is basically learn about some terminologies which we didn't mention all of them, but our focus is on the prefix, the main word, and then the what? The suffix. Okay? Prefix and suffix modify, they change the meaning of what? What the root word. Okay? And it kind of, the suffix in particular, kind of tells us what procedure they are going to do on that part of the human body. Okay? And we are also saying that if we know these terminologies, it makes us to be able to get the right instrument ready for them to do what? Surgery. And then the patient will come out with good results. And everybody, that is the worker, the patient family, the surgeon, the medical team, in the whole world, everybody comes out with happy.
You see the case cards.
Yeah.
They list like what the doctor might do.
Mm-hmm.
So the
This terminologies, yes.
You have to learn everything. You have to
No,
learn everything.
no, you can't. You can't do that. You will not be able to do that. No. So you cannot you get headache. All right. You'll be able to know some of them by constant work, review, or practice. You get to know some of them. And the work is such that it's cyclical. What I mean by cyclical is such that, you know, the cases you do your hospital, you do every Monday. You know the one that you do every Tuesday. You know the procedure they do every Wednesday. So you know that every Monday we are doing a lot of cystos. Every Tuesday we are doing a lot of orthopedics. Every Wednesday we are doing maybe ear cases. So you that is going to be there. You see, once you get there, you know. Then they will keep you maybe one vascular here, one ENT here, as this. But every day they have a particular case that they do. So the procedure, some of them, trust me, if you read the whole procedure, you go crazy. You don't even understand what they are talking about. So all that you need to do is just on the pick list. They have the what do you call it? The anesthesia medicine that they will have to give and the quantity they have to give. Everything is listed there. That is for the anesthesiologist to follow. Then they have the material that they have to put on the bed and put on the table where they are going to set the instrument. That is the supply, the drapings, the bowls that they need, the gauze, the knife blades, the what do you call it? The suture sizes that they need to be able to sew back the place to close the surgical site. That is the work of the OR, the materials management, to pick. Then under the heading, they have instruments. That is where your focus will be. They say that maybe they need, if it is a parodontomy, that means neck. So you get head and neck tray. You definitely need a head and neck tray to do that. And then any other, maybe you need a camera or a scope, it will be listed there. So you just pick that and give school. So you if you want, you can know everything. I forgot your name. Musha. Yeah, Musha, you can know everything. Okay? You just have to know some basic one, and then you're good to go. Any other question? Online viewers, online class, any question?
I have.
Yes, Fatima has a question. Let's answer the question and we are call it done.
As teamwork. So if maybe I go to work in the morning and in the afternoon someone is coming to take over. The morning staff, you have to do
handing over.
Handing over. Handing over as the nurses do.
Yes. Handing over, yes.
Please, can you repeat Fatih's question?
So Fatih is asking that if you work in a hospital or you are employed and your shift is 3 or 7 to 3, and when you are leaving, do you have to hand over to the shift that is coming after 3 o'clock? And my answer is what? Yes. It is not it's not necessary that you have to sit them down and tell them all that you have done. It is not every day that you have to hand over. You only hand over if there's a task that you have not completed. Okay, so let's say that, like I gave example when I used actually, what was the name again? Sorry if I keep asking your name. Asia. Okay, I was saying that if there's a tray that needs to be turned over and Asia did it, and it's a time to go, it's not cooked, and Mohammed is the one who is sterilizing. If Asia did not communicate, okay, let's say Asia did it, Mohammed was sterilizing, both of them are leaving at 3 o'clock. Okay, now the tray is not cooked. The 3 o'clock people are coming in. So now the handing over is that Asia will have to ask who is sterilizing for the 3 o'clock to 11 o'clock people. All the same, Asia doesn't even need to ask. All that he needs to go do is to go and read the schedule. See, the schedule today, Monday, who is sterilizing from 3 to 11? Oh, Kojo Mensa is the one sterilizing from 3 to 11. Kojo, this tray, they need at 4:30. Please, take care of it.
So by then I have to wait for him.
No, go home. Well,
So I have to write it down for him, right?
no, you just tell him.
No,
When he comes into the department.
Oh, that's what I'm asking.
Yeah, when he comes into the department, probably you need to wait for him to come.
Yeah.
Once he comes, you tell him the information. That's it. You're done. Your game, your day is you go home. If he doesn't do it, when there's a problem, it's on him. All right. But if you before you leave, let's say 3 to your work, your shift ends at 3 o'clock. If nobody is in the department from the other shift, the shift that is taking over, you cannot leave. The department cannot be empty. All right, so you have to wait. And then what it means is that you get paid some small overtime, and then the shift that is supposed to have come at the right time, that didn't come out at the right time, they get disciplined for not showing up on time. So I'll query them, or the manager will invite them to his office and ask them why they were all late. Maybe there was a train problem, everybody got stuck, or there was chaos in the city, everybody got, sometimes, or the weather was so bad, they didn't get in early. It makes sense. I get me. But most of the time, by the time you are leaving, like my place, oh, sorry, just 5 more minutes and you're out. My hospital, I have 3 people in the morning, or 4 people in the morning, I have 3 people in the afternoon, and I have night shift, I have 3 people. Okay, night, overnight. So the morning shift, before they leave, they have to make sure that at least one person is in the department before they leave. So that whatever handing over notes you give to that person. And then the person, if the person is not the one responsible for that job for that day, he will take the information, and then when the others come, you pass the information on. All right, so that's why communication is important. Thank you so much. Go and review and attempt the test. Okay. For me. Okay, thank you for your patience.